Welcome to TCM Board Formula Series. Today we review Wu Tang, Four-Substance Decoction. It belongs to the category nourish and regulate blood. The herb photograph shows Shu de Huang botanical, Rehmannia glutinosa, medicinal part, prepared root. The fastest memory hook is this: 4 herbs balance rich blood nourishment with gentle movement so tonification does not become static. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Shu de Huang deeply nourishes blood and yin. By Shao nourishes blood and preserves yin. Dang Gui nourishes and gently invigorates blood. Chuan Xiong moves blood and qi within the blood level. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Shu de Huang. The deputy level is Dang Gui. The assistants are by Shao. The envoy role is Chuan Xiong. Together, the formula nourishes blood, regulates blood, supports menstrual and circulatory function when the pattern matches. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is blood deficiency with enough constraint or stasis to require gentle movement. Look for this clinical picture: pale or sallow complexion, dizziness, palpitations, or dry skin, scanty, delayed, or irregular menses, abdominal discomfort associated with blood deficiency. The tongue is pale and thin. The pulse is thin or choppy. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Ba Zhen Tang A Euro adds spleen qi deficiency and stronger fatigue or poor appetite. Dang Gui Buletin Shui Tang A Euro severe blood deficiency driven by qi deficiency, with Huang qi dominant. Tao Hong Si Wu Tang A Euro adds Tao Ren and Hong Hua for more obvious blood stasis. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include abnormal uterine bleeding, pregnancy, severe anemia symptoms, or pelvic pain requires medical evaluation. A rich formula may worsen digestive weakness, dampness, or food stagnation. Use caution with active bleeding and around surgery. Modern medication review includes Dang Gui and Chuan Xiong warrant review with anticoagulants, antiplatelets, and bleeding disorders. Monitor additive effects when combined with other blood-moving herbs or supplements. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. 4 blood herbs. Number 2. Nourish and move. Number 3. Pale thin tongue. Number 4. Thin or choppy pulse. Number 5. Foundation for many blood formulas. The one-line recall is: 4 herbs balance rich blood nourishment with gentle movement so tonification does not become static. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Wu Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.